A federal effort to streamline the schedule for COVID-19 vaccines is creating some controversy tonight among health experts. Here to share his thoughts is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Good to see you, Doctor.
Hey, Dr. T. Great to see you. Hey, I got to be honest with you. Some of us have lost track of how many shots we should have received by now, how many we've gotten, and when we've gotten them, and there's just shot after shot after shot after shot.
Right.
So do you think it's been a challenge for doctors, too?
Absolutely, Eddie. I've had 4 shots so far, but there are immunocompromised people that have had 6. So it is hard to keep track. And I think this FDA meeting that's going to be coming up on Thursday is really going to discuss trying to simplify this process. Let's face it, we're in a different place than we were 3 years ago. It's more endemic. Not as severe as it used to be. So I think they're going to try to morph it into more like what we do with the influenza vaccine. Mm-hmm. Hopefully for the general population, you'll only need 1 shot a year as opposed to, twice a year. Again, there may still be vulnerable people who need it twice a year. So stay tuned. I think overall things are going to be simpler.
So, Doctor, the FDA is reviewing whether to simplify the process, making COVID vaccinations more like something that you get every year with your flu shot. So take us through it. How would that work?
Right. And this is something we have a lot of experience. Now, what's important to know, Maria, is that, we don't have studies necessarily that tell us for sure that vaccines twice a year are better than once a year, or that for certain people once a year are enough. So I think what the FDA is saying is that for most healthy people, that probably an annual shot is going to be enough. But there still may be vulnerable people, the immunocompromised, perhaps the elderly and some other groups, that at least at the outset, they want to continue having twice yearly boosters. With that said, I think some of the other points about the FDA is they want the composition of the vaccines to look similar. Uh-huh. So right now, if you're getting your first primary series, you're just using the monovalent or single sequence like we did in the beginning. The boosters now are bivalent or 2 sequences. I think they're going to try to harmonize it to make it the same for individuals and for the different companies. Overall, I think it's going to be a simplification that is needed at this point.
So you started to go down the path that I wanted to go down. You have said many times before that COVID is not the flu. It spreads faster. It mutates more often. And so far, it hasn't settled into just one season. So what are some of the other challenges that vaccine developers are facing?
You hit the nail on the head, Ed. Here's the bottom line. We cannot keep pace with the development of vaccines to keep up with COVID. COVID is just too fast. That cat and mouse game that's happening, COVID is really winning as far as finding new variants before we can get the vaccines developed. So I think that's another point to say that perhaps we don't have to do that. Why? Because the vaccines, even probably at once a year, are still going to decrease the likelihood of severe illness. Mm-hmm. And then for the more immunocompromised or elderly, perhaps that will stay at twice a year. And as long as it's keeping us out of the hospital, I think that's really the key. Are we going to be back where we were, where the vaccines are going to be able to prevent transmission and infection? Maybe for a short period of time. But unfortunately, the virus is outsmarting us in that regard. We're going to have to learn to live with it. Let's face it. Mm-hmm. We already have. We've learned how to live with this. I think things are going in the right direction.
All right, Dr. Todd Ellerin, thank you so much for being with us. As always, be well.
Great to see you, Dr. T. Thanks for your time.
And to our viewers, if you have any COVID-related questions you'd like our experts to